Now I will show you an assisted method of collecting saliva. The setup of this part is exactly the same as spitting method. We have a tube, the funnel, it goes on the top of that, and making sure tube remains upright and the buffer doesn't come out of the funnel. Also make sure the patient mouth is clean, as I mentioned earlier. But this assisted method would require the use of swabs. Now essentially the swab, there are two swabs, both are identical and you can use any of them. And essentially the use of this swab is to capture the saliva from the patient's mouth, and which we can later on transfer to the tube itself. As you can imagine, it would require multiple attempts, and particularly in a patient who is not cooperative, and therefore this method has to be restricted to very young children under the age of 3 years or patient who cannot follow the commands. And this would also would take more time compared to spitting method. So the first of all, we will rub this swab to between the cheek as well as gum or under the tongue, and these are the places where best to get saliva, and it's quicker to get it this form moist. So let me just show you how to do it. It hardly takes a second to for this form to be completely moist. So when the swab is moist, the next job is to transfer this saliva from the swab to this tube, and this would be done by you, whereas the guardian or parents can use the swab to rub in patient's mouth. You can use both swabs to make this process quicker. You can give one to patients while they are rubbing around in the mouth, whereas the one you can use to transfer the saliva, therefore makes the process a bit more faster. So let me show you how to transfer the saliva from the swab to the tube. So once the swab head is completely moist, let me show you how to extract saliva from the swab. So all you have to do is to push the swab head against the side of the funnel like that, and with a screwing motion you can rotating, and you can see the saliva is simply coming out of it. So press it against the funnel and then you rotate. Once you once the saliva comes out of the swab head, that can go back in the mouth again. You can bring it back, and again the same thing. Thank you so much, Mrs. Patel, for agreeing to participate in our study.
No problem.
So as I mentioned earlier, all we need is a saliva sample, and it's not going to be painful at all for Om when we do that. And because he's very young, we will be using these swabs. Now these swabs are just sponges only. They are not toxic, they're not going to be harmful, and all we want to do is to rub this swab in his mouth.
Yeah.
And all it does is, because it's a sponge, it will attract water and it will collect the saliva.
Okay.
So it's really easy to do that. Once you finish with one swab, give it back to me. I will take some saliva out of this swab into the tube while you're collecting saliva from the other.
Sure.
All right. Okay. Here we go.
Okay. Let's try this one. Go ah. Good boy. Well done.
Oh, he's enjoying it, isn't he?
Yeah, he seems to be loving it.
Okay. Thank you very much. And this is the second one.
Oh, can you go ah?
That's very
That
nice.
was funny, was it? That was funny. Tickles, more tickles.
Oh wow! Lots of saliva is
Lots
coming out.
of saliva.
Very good. Thank you very much.
Good boy. And open again. Open. Thank you.
Okay, so now we have finished collecting saliva. So the first of all, you have to make sure you fill the required amount of saliva, and this is extremely critical to get enough DNA for subsequent analysis. We want to collect saliva up to this arrow or up to 2 ml. Now what you would notice here is that saliva creates a foam. So what we want is that a level of liquid has to be at 2, not the upper level of foam, but actually the upper level of liquid has to reach to 2 ml or up to this arrow. And this is very important. So we are not including the level of foam, which is actually at 3 ml, but we are using the level of liquid as a marker how much saliva has been collected. So once you are happy that you have enough saliva, the next thing you would do is to remove this funnel, which you don't need it anymore, and you can throw it in a bin, and you put this cap back. Make sure you tightly close it to prevent any spillage. The next thing you have to do is to mix the buffer and saliva adequately, and this can be easily done by inverting tubes for about 5 times. Once the tube is mixed, you are happy with a required level of saliva. The next and more important part is to put a label on this tube. Now you have noticed that I haven't put the label before collecting saliva, and this is very important, is because as a best practice you should always put a label after collecting a sample, as we normally do in a blood sample, and we should follow the same principle here. So out of the 4 labels you find in the pack, you take the saliva sample, which it says on the label, take it from the label simply put it on the tube. And that's it really. We have finished collecting saliva.